Okay, so before we get started, I'm just going to go ahead and scan the room. It is just the two of us and our laptop today, so we're going to have to move it around as we go. But over here, we've just got our supply station. This is where we're going to be performing some of the exam. There's nothing over here. Okay. Our area is free and clear. So we'll try setting this up over here this time. Let's see if that works. Okay. Hi, good morning.
Good morning.
My name's Leanne. I'm going to be your nurse practitioner today. I'm just going to go ahead and wash my hands before we get started. Okay. So today we're going to be doing a full head to toe assessment. Before we begin, is there anything that's bothering you?
No.
No. Okay, great. So I'm just going to start overall. You're well appearing, normal general appearance. There's no obvious abnormalities or deformities. Your skin is warm, dry, and intact. You've got no tenting. Can I just have a look at your fingers here? Okay, so our nails are symmetrical. We've got symmetrical nail beds. There is, good. Our nail beds are nice and pink. Moving on to your hair. The hair is evenly distributed. There's no obvious hair loss or thinning noted. Okay, so first I'm going to start by taking an overall look at your facial features. So your eyes appear symmetrical, ears are symmetrical, nose is midline, mouth is symmetrical, there's no facial droop. Everything appears normal. We're going to go ahead and get into your eye exam first. So the eyes are symmetrical, the eyebrows extend beyond the eyelids. Can you close your eyes for me? The eyelids are free of any swelling. You can open. There's no drainage noted. Pupils are equal and round. If you can, go ahead and pull down on your eyelids and look up. Good, there's no foreign bodies noted. The sclera is white. Okay. So, what I would like to do first is the vision exam. So, if you could go ahead and cover up your right eye for me and hold this out and read the lowest line.
374258.
Very good. So that is 20/30 vision on the left eye with corrective lenses. And I would go ahead and I would repeat this again on the right side. Good. Thank you. Next, I'm going to go ahead and test your peripheral vision. So let me know when you can see my finger.
I can see it. I see it. I see it.
Good. Now I want you to go ahead and keep looking at my finger here and just follow it with your eyes. Good. There's no nystagmus noted. So right now when looking at your pupils, like I said, they're equal and round. They're about 3+ or so. Okay, so you can just have a look at my finger here and then look behind me at the wall. And back at my finger and up at the wall. Okay, good. And when looking at my finger, your pupils are constricting and they dilate when you're looking away at the wall. So very good. Next, I am going to have a closer look at your eyes. Okay, go ahead and just look straight ahead for me. Good. Our pupils are equal, round, and reactive to light. They go from 3 to 2 millimeters with light. And I do see the consensual light reflex in both eyes when checking. Now, do me a favor and look up at that light. And I can see the light shining in equal in both eyes as well. Very good. Okay, if you can do me a favor and remove your glasses, I would like to take a closer look at your eyes. So, I'm going to start here. And I can visualize the red light reflex. And I'm visualizing if you can keep your eye open, there we go. I'm visualizing the optic disc and blood vessels as well, and those appear normal. And then I would go ahead and do the same thing on her right eye as well. Good. Okay, so that concludes our vision exam. Next, I would like to go ahead and take a look at your ears. So you can put your glasses back on. Perfect. So your ears are symmetrical. They're in proper alignment. Auricles are symmetrical. I'm just going to feel here. Any pain?
No.
Okay. So no pain. There's no swelling. And I'm going to have a look inside of the ear. Okay, and I'm visualizing the tympanic membrane, and it is a light pearly gray, and there's no drainage noted. And I would repeat this as well on the right ear. Very good. Next, I'm going to test your hearing. So if you can just tell me, if you can repeat after me.
A, B, C. 1, 2, 3.
Very good. Okay. So with this next test, I would like you to let me know if you hear the same sound in both ears or if you hear something stronger on one side or the other.
Same.
Okay, very good. And then with this next test, I want you to let me know when you stop hearing the sound.
Okay. Okay.
Okay, good. So we've got a 2-to-1 ear to bone conduction. So no signs of hearing loss there. Okay, I'm going to just palpate your temporal arteries. Good. 2+ bilaterally. And if you can open and close your mouth, I'm just palpating the TMJ. Good. There's no clicks. Is there any pain with that?
No.
Okay, very good. Before I move on to the nose, I just want to go ahead and palpate your sinuses. So just let me know if you have any pain.
No.
Okay, and if you can lift up your glasses for me just a little bit.
No.
Any pain? No? Okay, great. Okay, so moving on to your nose. The nose is symmetrical. It appears midline. If you could just take a finger and close off one side for me and take a breath in. And the other side. Good, the nares are patent bilaterally. And I'm just going to go ahead and take a look inside of the nostril. Okay, so the septum is midline. The turbinates appear to be pink, and we do have some clear watery discharge. And I would repeat that on the opposite nare as well. Okay, lastly, your mouth appears symmetrical, lips are symmetrical. Can you open your mouth for me? Can you pull down on your lip? Okay, we've got moist mucous membrane. Stick out your tongue. Say ah. Very good. The tongue is red and soft. Very good. Okay. The neck is midline. I'm going to go ahead and I'm going to palpate the trachea. So, do me a favor and put your head down just a little bit and kind of tilt it to the right. Okay, and swallow. Okay, so the trachea or the thyroid. I was palpating the thyroid. The thyroid is freely movable and there was no nodules. Next, I'm going to go ahead and I'm going to palpate your lymph nodes. So, first we've got postauricular, preauricular, submandibular, submental, and then if you could put your head down a little bit for me, the posterior cervical lymph node chain, and look up, and the anterior cervical lymph node chain. Good. And then supraclavicular and infraclavicular. Any pain with that?
None.
All right, very good. Next, we're going to go ahead and we're going to move on to the lung assessment. So, I'm looking, thoracic appears normal, chest rise is symmetrical, respirations appear to be unlabored. So now we're going to go ahead, make sure that you can see over here. Okay, perfect. So I'm just going to check for your thoracic expansion here. Maybe I should move this a little bit. Okay, so now I'm checking for thoracic expansion. If you can give me a deep breath. Okay, thoracic expansion symmetrical, about 4 millimeters on each side. So very good. Okay, and now I'm going to have you just say 99, please, every time I move my hands.
99, 99, 99, 99.
Good. No tactile phragmitis noted. Next, I'm going to go ahead and I'm going to percuss. Good. Okay. Tympanic throughout. Next, if you could say 99 every time I move my stethoscope. You can start.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. And if you could say E every time I move my stethoscope.
E, 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 E.
Okay, good. No egophony noted. So now I'm going to go ahead and I'm going to take a listen to your breath sounds. So if you could give me a deep breath every time I move my stethoscope, that would be great. And then you could take a few normal breaths for me. I'm just going to listen. Another deep breath. Good. Okay. The lung sounds are clear. In all lung fields, there's no adventitious breath sounds. And I would go ahead and I would repeat the auscultation on the anterior as well. Okay, so now we're going to have you go ahead and lay back on the couch. Okay, so I'm just going to, here, maybe I kind of sit by you here. Okay, I'm just visualizing your chest. So the precordium has no pulsations. Everything is symmetrical. I'm actually going to go ahead and I'm going to take a listen to the carotid. Okay, no bruit noted. Next, I'm going to palpate the PMI, which is fifth intercostal space and midclavicular line. I'll raise this up here. Okay, the PMI is 2+. Next, I'm going to just take a listen to the different valves in your heart so you can go ahead and breathe normally. First, I'm listening with my diaphragm of my stethoscope. So aortic, pulmonic, and then I'm going to flip this up here. We have tricuspid and mitral. And then I'm going to repeat that with the bell of my stethoscope. So aortic, pulmonic, tricuspid, and mitral. Good. There's no murmur noted in any of the valves. Okay. So overall, there is no signs of cyanosis. Our capillary refill is less than 3 seconds. I'm just looking for I'm just testing here for edema. There is no edema in any extremities. I'm just going to palpate your pulses. So we have femoral, which this is 2+. While I'm here, can you go ahead and cough for me? Good. Any pain?
No.
Okay. And there's no hernias noted as well. I'm going to go ahead and check your pulses here. And your pedal. Okay. And we've got 2+ pulses throughout. Very good. Okay. Moving on to the abdomen. Are you comfortable with lifting this part of your shirt here? Okay. So the abdomen appears, I'll just kind of come here. The abdomen appears symmetrical. There's no pulsations. There's no peristalsis noted. There's no masses, no hernias. It's symmetrical throughout. So I'm going to just take a listen here. Okay, and we have normal active bowel sounds in all 4 quadrants. If you would be able to just hold that. Thank you. Okay, next I'm going to go ahead and do some percussion. Okay, so the abdomen is tympanic with some dullness over organs, which is normal as expected. Next, I'm going to go ahead and do some light palpation. So let me know if there's any tenderness here.
No. 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 No.
Okay, and now I'm going to do a little bit deeper palpation.
No. 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 No.
Very good. Okay, so I'm going to palpate the liver border here. So actually, if you could go ahead and put your right arm above behind your head there. Very good. So okay, so now go ahead and give me a big deep breath in. Okay, and let it out. Very good. Any pain with that?
No.
Okay, so negative Murphy sign. The liver border was not palpable. And now I'm just going to try and palpate the spleen. And the spleen is non-palpable as well. Okay. Lastly, I'm just going to listen to the renal artery. Or I'm sorry. Listen to the aortic artery. Aortic. And then renal. Renal. And iliac. Iliac. No brewing noted. Okay, very good. If you would be able to return to the chair for me. You know what? I'm going to have you sit up here and just face this really quick before I forget. I'm just going to test for CVA tenderness. So let me know if you feel any pain with this.
No. No.
Okay. No CVA tenderness. Okay. Okay, so now I'm going to go ahead and I'm looking at your upper extremities. The upper extremities appear symmetrical. There's no deformities, no obvious abnormalities. Everything looks intact here. Can you do me a favor? We're going to do some range of motion. So can you give me some big arm circles? Good. And backwards. Good. Can you bring your arms up and down, out, down? Can you give me some arm circles? Very good. Show me your fingers and close them together and out. Very good. So I'm going to test some of the strength here. So go ahead and put your arms out for me and push up. Good. And push down. Good. 5 out of 5 shoulder strength there. And go ahead and put your palms out for me. And put them like this. And then push up against my hands and push down. Very good. 5 out of 5 strength bilaterally. Go ahead and grab my fingers and give them a squeeze. Good. We've got 5 out of 5 hand strength bilaterally. Let's see. Go ahead and put your arms up for me and push against my hands. Good, and pull. Good, we've got 5 out of 5 strength there as well. Next, I want to do the near test with you. So if you can go ahead and put your arm straight out for me and turn your hand out. Good, and raise it all the way up by your ear. Any pain?
No.
Good. You can bring that back down. Okay, and you can relax your arm. And I would repeat that on the same side, but we do have a negative near test. Next, I'm going to do the Hawkins test. So, I'm going to just pull this. Any pain?
No.
Very good. And I would repeat that on the other side as well. For upper body, I believe that's everything that I wanted to test. Okay, so we'll move on to the lower body. The lower extremities, again, these also appear symmetrical, no obvious deformities, there's no injury, everything appears normal. Would you be able to do me a favor and stand up? We're going to just look at your hip range of motion. So, maybe we move. I'm going to move this. Why don't we come over here? This way we can see a little bit better. Okay. Now, if you can you raise your leg out to the side and pull it in front of you and across? And can you bring your leg behind you and in front of you? Good. And can you take your leg and can you turn it inwards and outwards? Very good. So we have full hip range of motion, and I would go ahead and I would repeat that on the other side as well. While I've got you standing here, I want to look at your knee range of motion. We may have to repeat this sitting down, but if you can just kind of keep your hips straight, but lift your leg up behind you. Very good. And can you kind of straighten it in front of you? Very good. So it looks like a full knee range of motion as well. While I also have you standing, I'm trying to coordinate this, but I'm probably going to have you stand back up anyways. But I'm going to have you lean forward. I'm just looking at your spine. Can you go ahead, bend forward, and try and touch your toes? Okay, so we've got the spine is in proper alignment. There is no scoliosis noted. Very good. You can stand back up. I do want to test the range of motion of your spine. So would you be able to, you already showed me, but kind of bend forward a little bit? Can you lean back like you're doing a back bend? Can you twist side to side? Can you I want you to kind of repeat after me. So we're going to try and reach the side of our feet, and on the other side. Very good. So we have full spine range of motion. Okay, you can go ahead and have a seat again for me. And I would like to test your hip strength. So go ahead. I want you to let your legs dangle here. Okay. And go ahead and push up against my hands. Good. And on the other side. Good. 5 out of 5 hip strength bilaterally. I know you kind of already showed this, but let's look at your knees one more time. Are you able to kick your knees out, kick your legs out, and bring it back behind you? Very good. Okay. Now we're going to look at the knee strength. Maybe this will be better. Okay. So I want you to go ahead and pull against my hands. Good. And push. Very good. And now I'm looking at your feet range of motion. If you can, give me some foot circles here. Very good. And put your feet out. Point them in. Pull them up. Point them down. Very good. And now we're going to look at the foot strength. So, let's try this. Okay. So push up against my hands and push down. Very good. We have 5 out of 5 strength bilaterally. Whew. Very good. So, I think that's everything that I wanted to test in your lower extremities. I did your hips, I did your knees, I did your feet, did your back. Okay, so next, what I would like for you to do is we're gonna show off your walking. So you could stand up and just walk straight ahead for me. Good. And if you can walk heel to toe on the way back. Very good. So we have a normal steady gait, and then we have an intact heel to toe walk. Very good. Okay, while I've got you standing before you sit back down, I want you to just go ahead, put your arms out in front of you, close your eyes. Good. We have no swaying. Very good. And then you can relax for a second. And I want you to close your eyes again, put your palms up, arms out all the way up, and stand here. And I'm assessing for pronator drift, which we do not have any. Very good. Okay. Perfect. Okay. So go ahead and have a seat for me again. I would like to test your, we're going to do a shin test. So if you could take your heel and bring it down your shin all the way down. Good. And the same on the other side. Very good. Okay. I also am going to test some rapid movements. So if you can just move your hands very quickly. Can you? Very good. Our rapid movements are intact. Perfect. Okay. So you did heel to shin. You did, I would like to test your dull and sharp sense. So I've got a cotton ball, and this will represent dull. And then I've also got the end of my reflex hammer here as sharp. So I want you to close your eyes, and I'm just going to start here. I want you to let me know if what you're feeling is dull or sharp.
Sharp. Dull. Sharp. Sharp. Dull.
Good. And I'm going to do the same on your feet here. Can you put your feet down and take off your slippers for me? Okay. And tell me what you feel.
Dull. Dull. Sharp. Dull. Sharp.
Very good. Okay, you can open up your eyes. I'm going to actually do a few more tests here on your feet. If you want to leave your slippers off. We're going to just test the vibratory sense on your feet and on your toes. So let me know if you feel the vibrate.
Yes. 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 Yes.
Very good. Okay. I would like to test your plantar reflex, which we may save for last because I don't know if we'll be able to visualize it. Or you know what? Maybe we can. Let's do this. Okay. So, let me see your foot here. Good. And then on the other side. Good. Our plantar reflexes are intact. Okay. So, would like to test your reflexes. So, I'm going to start over here. We're going to start with the tricep. Let this arm just kind of hang. Good. And the tricep is 2+. do the... There we go. Bicep is 2+. I want you to let your knees and your legs kind of just dangle here. Maybe we'll go over here. Patellar is 2+. Okay. You put your weight there. Very good. Okay. And our pedal is 2+. And I would go ahead and I would repeat those deep tendon reflexes bilaterally on the other side, but our pulses were 2+ throughout. Okay. Trying to think what else I am missing. We did cranial reflexes, tenderness. Checked all your pulses. We did a range of motion. I think that concludes our exam. Thank you very much.